Hello, everyone. My name is Algarin. I use he, him pronouns, and I am proudly assistant professor at Edson College of Nursing and Health Innovation. And today, we're going to talk about sex. So now, I know that all of you are really great at participation because I got to see your presentation with Zach. So I like my presentations to be a little bit more interactive, so I hope that you all can do me a solid and interact with me up here, okay? So when you last saw your healthcare provider, just think about, what did you discuss? Was it a routine checkup? Did you have cold or flu symptoms? Did you want to go get that weird bruise checked out, right? But did you talk about sex with your healthcare provider? How about your sexuality? How about substance use? Probably not, but in 2022, there were around 19,894 people living with HIV in Arizona and 975 new diagnoses. Between 2021 and 2022, there was an increase of 20% in new HIV cases. These are numbers that we haven't seen since the early 90s in HIV. It's alarming. More than 50% of cases were in Maricopa County, which is a federally recognized ending the HIV epidemic region. Now, a federally ending the HIV epidemic region is one region in the United States of 50 that make up more than 50% of new HIV infections in the United States. So what are the benefits of patient-provider communication? Patient-provider communication on sex, sexuality, and substance use improves clinical sexual health outcomes. This includes hepatitis A and B vaccine, HPV vaccination, HIV testing, and PrEP uptake. Not only is it important to disclose, but the way in which you disclose and that experience, and whether it's positive or negative, is also important. Alas, there are barriers to this patient-provider communication. On the provider side, they cite that they have a lack of time. They have a lack of training. They have discomfort talking about sex and substance use. And then on the patient side, you see stigma, medical mistrust, and low relevancy with the service that they sought. So when you went to go and talk about going to see the flu, maybe you didn't want to talk about sex with your provider because you were really just interested in talking about the flu. But maybe that was your only touch point with the healthcare system for that year, for 2 years, 3 years. So my lab and I are using an adapted patient-provider communication framework to better understand how patients and providers are communicating with one another about sex, sexuality, and substance use. I'm just going to talk a little bit about the patient side because patients, providers, and PrEP care coordinators all have needs, skills, values, and emotions that facilitate or provide barriers to this communication process. So, what do you think are some of the needs that patients have and when they want to go see their provider? They want treatment, right? They need treatment for wellness. How about some of those skills? What do you think are the skills that you need to communicate with your provider if you're a patient? Health literacy, thank you. Safe sex. Health efficacy. Communication in itself, having that ability to speak up, right? What are some of the values? Judy mentioned one earlier. Wellness is a value. Transparency, respect. How about some of the beliefs? What are some of the beliefs that patients have that make it so that they want to communicate with their provider? Trust, that they can get well. They talk about some of these myths that they hear on Twitter, and they believe in that. And they want to talk about that with their provider. So these different beliefs that maybe mismatch what the provider is telling them. And then what are some of the emotions that you think are there between the patient, with the patient, of why they may or may not want to talk with their provider about certain conditions? Fear, embarrassment, anger, judgment, yes. So these are all things that not only the patients have, because patients are humans, but also that providers have, because providers are humans, and our PrEP care coordinators, our pre-exposure prophylaxis coordinators also have. Now, it's not only about the way that people convey this message, but it's also about how somebody receives that message. So if I were to tell you, I'm engaging in sexual risk behavior, and my provider's like, oh, you are? Well, When you see somebody receive a message like that, yeah, it's kind of off-putting. But if your provider is more open and willing to listen and puts you as a patient and has patient-centered care, you might be a little bit more willing to open up and talk about these experiences. Because at the end of the day, our enabling goal is that the patient wants to get the best care, the provider wants to provide the best care, and the prep care coordinator wants to coordinate the care between the patient and the provider, so that in that way they can get on pre-exposure prophylaxis to prevent HIV. So in my lab, we plan to develop, design, and preliminarily evaluate an electronic screening method to facilitate sexuality and HIV risk behavior disclosure for PrEP uptake among HIV priority populations in Maricopa County. And this is going to be tentatively known as My Data, My Choice. So this is just a tentative flow chart, but the participant in a way, would go into the healthcare facility to engage with My Data, My Choice, that answers some screening questions that you particularly would probably be asked by, well, you should be asked by your provider, but sometimes those providers don't have time. They feel uncomfortable. They disclose sexuality, they disclose their sexual risk behaviors, and then they also disclose their substance use behaviors. So did they engage with My Data, My Choice? This is the first touch point where they have a yes or no answer. If they don't, and they don't disclose any of that information, they proceed with standard of care. If you have a provider that feels comfortable of talking about these topics, great, you're gonna get great care, right? If you don't, would you like this data to be shared with your provider? Yes, then they proceed with this information, their provider knowing this information. Or do you want to be connected to a prep care coordinator? So you're able to fill this out and not necessarily share this information with your provider if you don't feel comfortable telling your provider. What are some of the reasons you feel like people might not feel comfortable telling their provider? I can think of a couple. You're from a small community. Your aunt works at the front desk and she's the secretary of the clinic. You're a youth and you're afraid that the insurance is going to tell your parents in some way that you're now taking pre-exposure prophylaxis, right? So we want to give the autonomy and choice to the patient. And so if they do not want to share that information with their provider, then this information they have the option to share with a prep care coordinator so they can try to get connected to a provider that they feel comfortable with. Maybe somebody that's not associated with their parents' insurance. Maybe somebody that is not associated with their family or outside of their rural setting. And if they choose to be connected to that prep care coordinator, we hope that then their information, if they want it to, is sent to that prep care coordinator, and that prep care coordinator reaches out to them instead of them having to actively reach out to the prep care coordinator, because sometimes things just fall off of our plate. And when we have somebody that has that duty to connect us to the healthcare that we need, that it just makes all the difference. So if you have any questions about this project or any of my other research going on, I have my email up here, and please keep up with my lab at our Instagram page. We're always posting about our new engagements, and my lab mentees are super great. So thank you again so much.